Thank you, Dean Letney. Thank you for your very kind words. I'm delighted to be here. I'm just so honored to be here. A place of so much meaning to me in my life. I want to thank President O'Reilly and Dean Letney, Dr. Rosato, the members of the committee who asked me to serve in this capacity. Just delighted to be here. I would also like to thank my wife, Bonnie, for all of her support through the years, and she's always had an attitude of gratitude, which is contagious, and so thank you, Bonnie. My talk today will be about an hour. It'll be 1 hour in length. It's on Aquinas' account of double effect. This is an account that St. Thomas gives to us in the Summa Theologiae, where he addresses a difficulty in human life, where in our pursuit of the good is associated with the production of an evil, which is inextricably joined with the good. The evil doesn't produce the good. It's not a means to the good. So it's not a violation of St. Paul's admonition that we would never do evil in order to produce good. But it involves the production of evil as an inevitable concomitant of the pursuit of good. And the question that St. Thomas helps us with is, how do we evaluate those kinds of circumstances in a human life? My examples will be largely drawn from medicine, just because medicine is fraught with these kinds of hard cases. And also because this is where Aquinas' account receives the greatest resistance. And we'll be talking about the Consequentialists, which is a family of thinkers who oppose the account that Aquinas offers us. And so we'll look at those thinkers. In particular, we're going to look at a critique that's offered by a British philosopher from the 19th century, Henry Sidgwick. He offers the most telling criticism of Aquinas' account, and it's widely embraced, but rarely investigated. In fact, I know many people endorse Sidgwick's account, but few, if any, in fact, in my experience, I've never seen an actual examination of the argument that Sidgwick offers. So today, that's what I'll be offering. And spoilers alert, Aquinas has a response to Sidgwick's criticism. But let me begin with this painting, this fresco. This is a fresco at the Church of Santa Maria Novella in Florence, Italy. It's right near the train station. It's a big church right next to the train station in Florence. And if you're ever there, you have the opportunity to go there. You'd be able to go in and see this beautiful fresco, which was painted approximately within 100 years of St. Thomas's death by Andrea di Firenze, and Andrew of Florence. This is called The Triumph of St. Thomas and the Allegory of the Sciences. And if we look at this fresco, we'll see St. Thomas, as Father Kelly mentioned when he went to Paris. He did so partially in other places as well, not just Paris, but he would combat error, right? And here he's depicted in his triumph over the error that he had combated, represented by the thinkers Averroes, who was a commentator on Aristotle, who had some things. St. Thomas called him the commentator, so he thought very highly of him, of course. But there were some errors in Averroes' interpretation of Aristotle, and Aquinas set that right. And then Arius, who denied the divinity of Christ, and Sabellus, who denied the Trinity. And St. Thomas addressed those errors. But he didn't do that on his own, as Father Kelly mentioned, my classmate. Father Kelly mentioned St. Thomas, and the quote from Leo the 13th, St. Thomas encompassed the wisdom of the tradition. He absorbed it and represented it. And so he's accompanied there by all of the evangelists, St. Paul, Job, David, Moses. In the lower right-hand corner, we have the 7 liberal arts represented. We have Cicero, Ptolemy, Euclid. Those are all names familiar to you from the curriculum. We also have, on the lower left, we have Augustine, Jerome, popes. And so representing all of the resources that St. Thomas brought to bear in his miraculous career. So I will try to reference the curriculum. In some sense, you have the curriculum of Thomas Aquinas College represented here in the Triumph of St. Thomas. And I will, at times, reference the curriculum in my talk. I want to begin with St. Thomas's treatment of the natural law, which I believe you read in the junior year, where St. Thomas presents, he says, when we engage in practical thinking, practical rationality, reason, the first principle of the practical reason, or when we reason practically, is that we should do what is good and that we should avoid what is evil. Do and pursue the good and avoid the evil, or malum, what is bad, right? And St. Thomas says this is the principle that we rely on in all of our practical thinking. In all of our doings and our makings, we rely on that first principle. And he says, of course, if you were to contact your parents, right, and say, well, what did you learn today? And you said, well, I learned that we should do what is good and avoid what is evil. Your parents might call up the President O'Reilly and ask for a refund or a discount. Understandably, because St. Thomas he's not teaching us something that we don't already know, that we should do what is good and avoid what is evil. But what he's doing is he's drawing our attention that this is what we knew before we knew anything else. That's what he's drawing to our attention. That's a first principle. Do what is good and avoid what is evil. And but we'll see that the interpretation of how do we interpret that, it involves a little more thinking than we might initially think. And I want to develop that by focusing on examples from medicine. So if we look at the first principle of practical reason, as it's articulated in the practice of medicine, we will see the ancient Greek physician Hippocrates, who was a contemporary of Socrates. Hippocrates born probably around 460 on the island of Kos, which is right off the coast of present-day Turkey. And Hippocrates is the founder of medicine as we know it, the founder of the medical profession. And in a work called The Epidemics, Hippocrates says, as to diseases, develop finesse concerning two, help or at least do no harm. So Hippocrates says, in the realm of medicine, when we're dealing with the health and the sickness of a patient, the first principle of practical rationality is articulated as further the health of your patient and do not harm the health of your patient. You can see that's the first principle of practical rationality as it's found in the practice of medicine. Now, Galen, whom you do, I believe, read in the curriculum, Galen, he came along much after Hippocrates. He was born in about 129 AD, and he lived until about 216 AD. He was born in present-day Turkey in a city called Pergamon, He was a great student, a follower of Hippocrates. He would have been intimately familiar with the entire Hippocratic corpus, the body of literature that Hippocrates had written. And he commented upon it. Now, we should mention, Galen he was the most renowned physician of his age. So he went from Pergamum to Rome, to the capital of the empire. And there he was a physician to gladiators and to the emperor of Rome, Marcus Aurelius. Marcus Aurelius, in addition to being emperor of Rome, was a Stoic philosopher. He wrote a slender little volume called The Meditations, which I think that we used to read that in the curriculum. I don't know that it's any longer in the curriculum. I think maybe one of those works that comes in and out of the curriculum. But he was a Stoic philosopher, and Galen was his teacher, his physician. Now Galen, so you get a sense that Galen was a renowned physician to be the physician to gladiators. They were highly prized athletes, and then to the emperor, of course, you'd have to be a very well-regarded physician. And Galen was. And Galen tells us, he says, when I read the epidemics and I saw that Hippocrates said, as to diseases, practice to help or at least do no harm, I thought that was so beneath Hippocrates to even comment on this principle. I just couldn't bring myself to believe that Hippocrates had even bothered to write that because it's so basic. But Galen then goes on to tell us, he said, however, as I practiced medicine and I had more and more experience in the practice of medicine, I realized how fraught medical practice is with the task of furthering the health of your patient while not jeopardizing their welfare, their physical welfare, their well-being. And he said even the most innocuous or basic intervention in medicine challenges this principle. What was Galen kind of thinking about? Let's take a kind of very basic, down-to-earth case of the administration of aspirin. Aspirin, that's not what Hippocrates or Galen would have called it, but they were both aware of what was the root of the willow tree. The root of the willow tree, as you know from your first and second year of study of Latin, salix is the Latin word for willow. And the active ingredient in aspirin is acetyl salicylic acid, from salix, from the willow. So it's the root of the willow tree. They didn't know the active ingredient or the causal mechanism, but they did know, and Hippocrates and Galen both prescribed the root of the willow tree to their patients in order to alleviate a fever, for example. They would prescribe aspirin, the root of the willow tree. But the difficulty is that when you administer aspirin, or the root of the willow tree, to a patient, and they were aware of this, while it would alleviate a fever, it would also aggravate the lining of the stomach. So it would cause nausea. It would nauseate a patient, right? So the difficulty, of course, Galen is noting here is, are you abiding by this first principle of practical reason as it's found in medicine, as to diseases, practice to help or at least do no harm? Because while you are alleviating the fever, you're also causing nausea, you're nauseating the patient. So now Galen, of course, administered aspirin, and he may not have completely thought through why that would be okay. But St. Thomas does think about what's going on here. Are we violating the first principle of practical reason when we administer aspirin? is Galen violating the principle that Hippocrates has taught from the beginning of medicine? St. Thomas would, of course, say he isn't. But the question then is, why? Why is he not? So let's look at what St. Thomas has to say. And this is found in the Summa, question 64, article 7, where St. Thomas in the second part of the Summa, St. Thomas in that understated tone, just that quiet voice, he says, nothing prevents one action from having two effects, one of which is intended and the other of which is not intended, or praeter intentionem is the Latin, besides the intention. And St. Thomas says, what the moral character of actions is principally derived from what is intended, not from what is praeter intentionem, what is beside the intention. For what is praeter intentionem is accidental in the moral determination of an action. So, what does St. Thomas mean by intended? What does he mean by intended? What does he mean by praeter intentionem? What is intended and what is beside the intention? Well, St. Thomas, in his account of intention, he tells us in the Summa, in the first part of the second part, he tells us intention, as its name suggests, is to tend towards a terminus through a medium, right? So intention, from tendere, to tend towards, tending towards, when we tend towards something, there's a terminus, an endpoint. In this instance, we call that the end, what is intended by the agent. But tending towards, St. Thomas says, occurs through. We tend towards a terminus through a medium. In this instance, the medium would be the means to the end. So if we go to the example of aspirin, we administer aspirin, right? That's our means, in order to alleviate a fever. So we have the end of alleviating fever or the health of the patient, and we tend towards that end through the administration of the aspirin. That's our means to that end. So St. Thomas is bringing to our attention that when we intend something, we intend an end through a means. Interestingly, in his own discussion of intention, he gives the example of intending, from medicine. He says, we will health as an end. We will health as an end. We choose medicine as a means to achieving health. And we intend health through medicine. Or we intend to alleviate a fever through the administration of aspirin. So there's intention. What is praeter intentionem? What is that beside the intention? Well, it's not a means. It's not an end, right? According to St. Thomas. It is not, we don't achieve the health of our patient by aggravating the lining of his stomach. Nor is it the goal to aggravate the lining of his stomach, to cause him to be nauseated. What is it? It's beside the intention. It is what Thomas will call an eventus sequens, an event that follows upon, or we could call it a consequent, or a side effect, or a concomitant, something that attends what we're doing, but it's not what we're doing principally. However, it does attend what we're doing, and we are aware of it, so we are responsible for it. It is we're going to have to give an account of why we brought about the aggravation of the stomach in our attempt to alleviate the fever. It's voluntary, okay? It's something that's voluntary, but it's not intended. Okay, so, all right, St. Thomas, so we have the administration of the aspirin, we're trying to alleviate the fever, where the goal is that, and we know we're going to aggravate the stomach with the administration of the aspirin, and that's a side effect of what we're doing. But why, so we've got that, we understand that, but why, St. Thomas, why is this what's morally relevant? We could see that, you're right, there's a distinction here between the alleviation of the fever and the aggravation of the stomach. But why is that morally relevant? Why is that ethically important? Here we go back to Aristotle and St. Thomas's reflections on Aristotle. And in I believe your junior year, you read Aristotle's Nicomachean Ethics. And in book 3, chapters 1 through 5, Aristotle addresses the voluntary, the involuntary, the counter-voluntary, what is not voluntary, what is deliberate, what is chosen. And he does so because he says, well, of course, when we're talking about ethics and virtue and vice, we're concerned with what we praise and blame people for. And we only praise and blame people for things that are voluntary. If something is not voluntary or counter-voluntary, involuntary, we might use that word, we might even pity a person for something like that, and we don't blame them for things that are counter-voluntary or involuntary. So, in order to do ethics, we have to get on the table a good account of what is voluntary. Now, in Aristotle's treatment of the voluntary, I think he'll probably come close to your own kind of intuitive thoughts about what is voluntary. As St. John Henry Cardinal Newman said, when you read Aristotle, you realize that you're an Aristotelian. Right? He's like, wow, I've been thinking like him ever since I've been thinking. And that, I think, would be the case when you read Aristotle's account of the voluntary. He tells us that, well, the voluntary is what we know we're doing, where it's up to us. We're the cause. Ephoumin, it comes from us. And we know the particulars of which the action consists. Is not brought about by force, or bia in the Greek, where he means by being pushed or blown by the wind is his example. So the voluntary is what we knowingly and willingly bring about. Now, Aristotle says, interestingly, he says, well, the voluntary is something that we share with very young children. Infants and toddlers act voluntarily, and also animals. Cats, dogs, horses act voluntarily. So Aristotle goes on, and St. Thomas will call acts that are voluntary human acts. They're human acts. Aristotle goes on, and so does St. Thomas, to think about what is deliberate. What's the deliberate? What is choice? And Aristotle doesn't use the word intention. That's a Latin word. But we're not doing violence to Aristotle's account to speak of what he refers to as deliberate or chosen as intentional. But Aristotle goes on to think about the deliberate and the intentional because here, interestingly, when we deliberate about something, we are trying to solve a problem that we face as agents, right? So if you imagine Galen deliberating about the administration of aspirin, he encounters a fever, he has a patient of certain characteristics. He's wondering, how ought I to alleviate the fever? He enters into deliberation. He poses that problem to himself. He solves it when he discovers the means, aspirin, for the alleviation of the fever. And in deliberation, he forms in the intention, right, the plan to alleviate the fever by the administration of aspirin. And that action is deliberate and intentional. Now, notice, this is interesting, and Aristotle finds it interesting, and so does St. Thomas. When we deliberate, deliberation is itself voluntary, right? Deliberation is voluntary. Choice is voluntary. Intention is voluntary. Those are actions that we take concerning our own actions. So, of course, the intentional has greater moral significance, or a different type of moral significance, than what is simply voluntary but not deliberate. Things that are voluntary but not deliberate, like I'm moving my hands voluntarily but not deliberately. That has moral significance, but the things I do deliberately have greater moral significance because there's more of what ethics is about in those actions. Ethics being about the voluntary, the knowing and willing. So when St. Thomas says that properly human actions, he uses the phrase properly human actions, not just human actions, those are voluntary, but properly human actions, uniquely human actions, are deliberate and intentional and chosen. So this is why St. Thomas is saying the moral character of the act is determined by intent. The intent which bears on what he calls the object of the act, what we do, administering aspirin, and the end that in virtue of which we do it, in order to alleviate fever. So the aggravation of the stomach is voluntary, but it's not intentional. So St. Thomas, in his discussion, he's answered the question. He's told it, what is intention? What is prayer intention? Why is it morally significant? And why would we be able to administer aspirin in order to alleviate fever, even though it's going to aggravate the stomach? He'll tell us why, because he gives us criteria, and these are the criteria of double effect, that the good at issue cannot be achieved otherwise. This is the option that's available. There's not an alternative. The agent intends the good, the alleviation of the fever. The agent voluntarily and knowingly and willingly brings about the bad, but not intentionally. It's not brought about as a means, nor as an end. And the obligation the physician and the relevant parties have to alleviate the fever, which threatens the life of the patient, right, is greater than that to avoid causing nausea to a patient. Okay, so let's say, so Galen is out of trouble, if you will, concerning as to diseases practiced to help or at least do no harm, because we've got an account which makes perfect sense of how he is following that principle in the first principle of practical reason as it's found within the practice of medicine. Okay. Now, let's say that you talk to your parents after the talk, and they're like, "What did you do today?" And you said, "We had a professor who came and told us that it was okay for a physician to administer aspirin to a patient." I think another phone call to President O'Reilly, like, "Hey, I need a discount." I mean, you knew that before you went there. Okay, and that's humorous and fair to say. That's prosaic, mundane case. So let's take something concerning matters of greater pith and moment. Let's talk about things that are a little more significant. The aspirin illustrates the idea, but of course, St. Thomas doesn't give us double effect in order to deal with those cases, even though it does deal with them, but rather with more weighty subjects. So this is Venerable Pope Pius XII. And on the 24th of February in 1957, he was asked by the Association of Italian Anesthesiologists about a hard case. And these are cases that they had encountered. And they asked in particular about one specific case at the end of life, with which they would deal as anesthesiologists. And this has to do with, it occurs rarely, but it does occur frequently enough to require someone to address the difficulty. Sometimes at the end of life, patients are in such pain that their pain cannot be relieved without the administration of an analgesic or a sedative that also hastens the death of the patient. And that was the question that was asked by the Association of Italian Anesthesiologists. They asked Venerable Pope Pius XII, if we were to do this, would we be violating the natural law? Would this be illicit? Is this permissible? And also, we could, not that they asked him that, but Hippocrates, the ancient Greek pagan physician, in his oath, he says, "I shall not give a deadly drug, nor will I even suggest this to a person." Well, a physician who had taken the Hippocratic Oath, I think, could also ask the Holy Father, were I to give this drug at the end of life that causes the death of the patient, which hastens the death of the patient, would I be violating the Hippocratic Oath? And I think the Holy Father's answer answers both of those questions. But I want to, just to give you a sense of what we're talking about, I want to give you an actual case from the practice of contemporary medicine. This comes from a book written by a physician, Ira Byock, who actually practices medicine in Torrance, California. He was a past president of the American Hospice Association, and he has a wonderful book entitled Dying Well, Prospects for Growth at the End of Life. And he's witnessed thousands of deaths as a hospice physician. And it's just an excellent book. If you know someone who's at the end of their lives, it's an excellent work. And I want to also mention that Dr. Byock is a staunch opponent of physician-assisted suicide and of euthanasia. Let me describe the case that he was personally involved in. This is one of his patients, Mrs. Terry Matthews, who was afflicted with kidney cancer. This is Dr. Byock. This 31-year-old mother was absorbing, and her pain all but ignoring, more than 900 milligrams of morphine per hour. That's a tremendous amount of morphine. a very powerful analgesic. For brief moments, Terry awakened and smiled weakly. She would doze comfortably, but awaken with a start every 5 to 12 minutes. "I'm on fire," she would yell. Then, as the next bolus of medication, a bolus is a large dose of morphine in this instance, was taking effect, she would whisper, "I thought I didn't have to hurt." So, Dr. Bioch, who is an excellent practitioner of pain management, he knows what he's doing. He was unable to manage Mrs. Matthews' pain using large doses of morphine, to which she had become tolerant. But the pain was agonal and otherwise intractable, not treatable. So to treat her pain, Dr. Bioch, with Mrs. Matthews' consent and with the consent of her family, he resorted to thiopental, which is a barbiturate that sedates the patient, rendering her unconscious of pain. In such cases, thiopental also, as a side effect, depresses a patient's breathing to the point of cessation. As Dr. Bioch notes of Mrs. Matthews, Terry never regained consciousness after he gave her thiopental. She died peacefully Monday morning. Her breathing became ever more faint and finally ceased. And I note that Dr. Bioch goes on to write, people unfamiliar with the purposes of palliative care, where we're trying to alleviate pain and symptoms at the end of life, may see little difference between sedation to control persistent physical distress, which is what he's referring to, Mrs. Matthews' case, and euthanasia. What may appear philosophically to be a fine line is, in practice, a chasm, an abyss. So he's claiming, I think correctly, that this treatment of Mrs. Matthews is legitimate and listed, not a violation of the Hippocratic Oath or of the natural law, and is dramatically different from euthanasia and physician-assisted suicide, both of which Dr. Bioch, as I mentioned, is a staunch opponent of. Well, Pope Pius XII, in answering the questions posed to him by the Italian anesthesiologists, relied on St. Thomas's account of double effect and gave an analysis very similar to what I suggested concerning aspirin. And Pope Pius XII said that the administration of the drug, the sedative, if it is the only way you have of addressing this pain, this otherwise intractable pain, that would be one of the criterion. It's the only, there's no alternative. The Pope also said that the goal of the parties is the alleviation of the pain, not the death of the patient. They're not intending the death of the patient. The death of the patient is not, and this is kind of a reiteration of it's not being intended, it's not the cause, the death of the patient is not the cause of the alleviation of the pain. It's a concomitant, it's a side effect. And also that the patient had the ability to access the sacraments and of spiritual care at the end of life, and that the patient and the relevant parties consented to this treatment. Given satisfying those criteria, that would not be a violation of the natural law, according to the Pope. And certainly he's following St. Thomas's account of double effect. Okay, so there I think you can see that there's something of greater moment here than the aspirin case. Double effect is also used in conduct of war, to deal with harm to non-combatants. That's not where they're not targeted, but they are implicated in the use of force. So that's Aquinas' account. Now, that account was widely adopted and is found in, historically, was found in, as I said, the conduct of war, in medical ethics. But more recently, Aquinas' account has come under, in the last 200 years, has come under significant criticism to the extent to which, outside of Catholic circles, few people would really endorse the double effect that St. Thomas has presented. It's controverted, and I would say outside of Catholic circles, it's come to the point where few thinkers would hold to the principle of double effect, although not that long ago, it would be endorsed in law and certainly endorsed within philosophical circles. So what has happened? Well, this is where we're going to talk about the consequentialists. The consequentialists. So consequentialism, the consequentialists reject Aquinas' distinction between what is intended and what is praeter intentionem, what is intended and what is voluntary but not intended, or sometimes called intended versus what is foreseen but not intended. They reject that, and largely because it goes against their central thesis. If you look at the name consequentialism, it's a name that captures many species, many families of thinkers belong to that genus of consequentialism. But as its name, I think, unpacking its meaning tells us what they hold, which is that the moral character of an action is entirely determined by its consequences. It's pretty easy to get what they hold. They hold that the consequences and consequences alone matter. So St. Thomas thinks that consequences matter. He doesn't think they alone matter, certainly, and he thinks that they matter less than intent. But the consequentialists want to assert that consequences and only consequences matter, and therefore distinguish what is intended from what is foreseen but not intended. It doesn't make a difference to consequences, so it doesn't have ethical relevance. The first thinker who takes this kind of approach is Jeremy Bentham. So Jeremy Bentham, he would be called more specifically a utilitarian, which is a species of consequentialism. We won't go into all the details. But Jeremy Bentham, he's born in 1748, and he writes in 1789, he writes his great work called An Introduction to the Principles of Morals and Legislation. And in there, he says, well, there's this distinction. He calls it the distinction between what is directly intended and what is obliquely intended. But he means the exact same thing that St. Thomas has in mind. So he's familiar with the distinction. He says there is this distinction. So he endorses the idea that you can differentiate these things, but he denies the moral significance of the distinction. So, and that, of course, is based on his consequentialism. So, unfortunately, he doesn't give an argument against the intended foreseen distinction. He just says, well, it's incompatible with utilitarianism, so put it to the wayside. The next thinker is John Stuart Mill. Well, John Stuart Mill was a student of Bentham's. In 1861, he writes his great work called Utilitarianism. In that work, he acknowledges the distinction between what is directly intended and what is obliquely intended. He says it doesn't have moral relevance in the evaluation of actions, but he does acknowledge that it has moral relevance in the evaluation of agents. He says this is where its moral relevance is found. That claim that it's morally relevant in the evaluation of agents, but not in the evaluation of actions, becomes widely adopted. And you could see everyone thinks that this distinction has moral importance. So Mill has to deal with that fact, and he himself thought it had moral importance, but he said it's not important in the evaluation of actions, it's important in the evaluation of agents. And that becomes widely adopted. But of course, Aquinas thinks that it is morally relevant in both the evaluation of agents and in the evaluation of actions. So Mill, though, like Bentham, he doesn't really give an argument against the distinction. But the next thinker does. This is Henry Sidgwick. Henry Sidgwick is the Knightsbridge Professor of Moral Philosophy. He occupied a chair, a very significant position, at Cambridge University. He was born in 1838, and he died in 1900. And his great work, which he wrote in 1874, first published, is entitled The Methods of Ethics. Sidgwick is the philosopher's philosopher when it comes to consequentialism or utilitarianism. His star is rising, has been rising ever since he wrote The Methods of Ethics. And it continues to rise. He's becoming more and more significant thinker in contemporary ethics. And Sidgwick does offer an argument against Aquinas' account. And this was brought to my attention by the next person who's talked about, this philosopher, Elizabeth Anscombe. So Elizabeth Anscombe, she was born in 1919, she died in 2001. She was a convert, she was a great student of Ludwig Wittgenstein, the philosopher of ordinary language. And she wrote a lot about the makeup of action. She has a great work, a slender little volume on intention. And she is what I would call a covert Thomist. She's a covert Thomist. So she converted to Catholicism. She's British. She converted to Catholicism as a teenager. And she was in philosophical circles in Oxford and Cambridge in Great Britain. And she found out early on, if you started a philosophical conversation saying, well, as St. Thomas Aquinas says in the Summa Theologiae in Great Britain, that didn't get you very far. So she would, realizing that, instead of undermining her claims rhetorically, she would just say what St. Thomas said and give the arguments that St. Thomas gave. And then she found, I really get an audience when I do that. But she, in her remarkable essay entitled Modern Moral Philosophy, she writes about Sidgwick, and I'm quoting her now. The denial of any distinction between foreseen and intended consequences as far as responsibility is concerned was not made by Sidgwick in developing any one method of ethics. He made this important move on behalf of everybody and just on its own account. And I think it plausible to suggest that this move on the part of Sidgwick explains the difference between old-fashioned utilitarianism and that consequentialism. And in this essay, she coined the term consequentialism, as I name it, which marks him and every English academic philosopher since him. By it, the kind of consideration which formerly would have been regarded as a temptation, the kind of considerations urged upon men by wives and flattering friends, was given a status by moral philosophers in their theories. So Anscombe tells us Sidgwick, you have to look at Sidgwick to find out why have people rejected this distinction that St. Thomas has offered us. Now, she also claims that if you reject the distinction that St. Thomas offers, you will become a consequentialist because there's nothing left if you get rid of intention. And if you look at St. Thomas's account, if you get rid of intention, she's right, that's about all that's left is consequences. But she also says you'll be getting rid of absolute moral norms as well, because you need this distinction in order to navigate human life while following absolute moral norms. So So what is Sidgwick's move? I'll tell you that while it's been widely adopted, it's been rarely investigated. In fact, Anscombe herself doesn't tell us what is his argument. So let me read from the Methods of Ethics, a passage from Sidgwick. And it's true that this is widely adopted, rarely investigated. I don't know of any investigation of it actually, or quarreled with. So here's Sidgwick. The intention of an act may be judged to be wrong, while the motive is recognized as good, as when a man commits perjury to save a parent's or a benefactor's life. Such judgments are, in fact, continually passed in common moral discourse. It may, however, be said that an act cannot be right, even when the intention is such as duty would prescribe, if it be done from a bad motive. That, to take a case suggested by Bentham, a man who prosecutes from malice a person whom he believes to be guilty does not really act rightly. For, though it may be his duty to prosecute, he ought not to do it from malice. It is doubtless true that it is our duty to get rid of bad motives if we can, so that a man's intention cannot be wholly right unless it includes the repression, so far as possible, of a motive known to be bad. But no one, I think, will contend that we can always suppress entirely a strong emotion, and such suppression will be especially difficult if we are to do the act to which the wrong impulse prompts. Well, yet, if that act be clearly a duty which no one else can so properly perform, it would be absurd to say that we ought to omit it because we cannot altogether exclude an objectionable motive. It is sometimes said that, though we may not be able in doing our duty to exclude a bad motive altogether from our minds, it is still possible to refuse to act from it. But I think that this is only possible so far as the details of action to which a right motive would prompt differ to some extent from those to which a wrong motive would prompt. No doubt this is often the case. Thus, in Bentham's example, a malevolent prosecutor may be prompted to take unfair advantage of his enemy or cause him needless pain by studied insults, and it is obviously possible for him and his duty to resist such promptings. But so far as precisely the same action is prompted by two different motives, both present in my consciousness, I am not conscious of any power to cause this action to be determined by one of the two motives to the exclusion of the other. In other words, while a man can resolve to aim at any end which he conceives as a possible result of his voluntary action, he cannot simultaneously resolve not to aim at any other end which he believes will be promoted by the same action. And if that other end be an object of desire to him, he cannot, while aiming at it, refuse to act from this desire. So this is the case of malicious prosecution. What is Sidgwick saying? Sidgwick is saying ought implies can, and ought not implies able not to. Let's take our malicious prosecutor who has malice towards the person whom he ought to prosecute. You ought not to prosecute for malice. That's the intent. So St. Thomas would say, and he does say, you ought not to prosecute for malice. But this individual, according to Sidgwick, isn't able to prosecute without malice. So we can't tell him that he ought not to prosecute for malice because we'd be violating the ought implies can principle, or the ought not implies able not to. Because this individual, according to Sidgwick, he's not able to prosecute without malice. So Sidgwick says we can't give the intended foreseen distinction the moral significance Aquinas claims it has in the evaluation of actions, because if we do, we're going to have a whole cohort of agents who are not able to do the right thing because they'll do it for the wrong reason. But if they can't do it but for the wrong reason, then it's not true to say that they ought not to do it for that reason. That's what Sidgwick is saying. So Aquinas' use of the intended foreseen distinction would violate this more basic principle that ought implies can, that ought not implies able not to. That's Sidgwick's move. This move has been widely adopted, and it's been applied outside of cases of malicious prosecution, like in other circumstances, which I won't go into now. But the question then is, well, we call it Sidgwick's move. That suggests a dialectic between Sidgwick and St. Thomas. And I think Anscombe is correct to call it Sidgwick's move. It's his response to an account with which he's familiar. The question is, does St. Thomas have a reply? And you should not be surprised to learn that he does. What is the situation? How does Thomas describe this agent, the malicious prosecutor? St. Thomas says that the malicious prosecutor is in a case of moral perplexity. That's the term that St. Thomas uses, moral perplexity. Perplexity, the Latin term, thoroughly tangled up, morally, thoroughly entangled. That's the situation that St. Thomas thinks that the malicious prosecutor and other agents like him have gotten themselves into. St. Thomas says that there are two forms of moral perplexity that we can imagine. One he calls simple, where through no fault of one's own, one simply finds oneself in a circumstance in which if one acts, one will act badly, and if one refrains from acting, one will act badly. So no matter what one does, one will violate moral principles. And St. Thomas says there is no such thing in the life of a human being such as simple moral perplexity. It doesn't exist. Innocent people will never find themselves in a case of simple moral perplexity. However, St. Thomas says, we can find ourselves in what he calls moral perplexity secundum quid. You could call it conditional, you could call it self-imposed, you could call it stipulated, qualified. He says, however, we can find ourselves in a case of moral perplexity that we've gotten ourselves into. So let me give you an example of something. We might call these moral dilemmas. That's a Greek word. But here's something, St. Thomas's treatment of the malicious prosecutor. Something, the case, if you will, generically. This is St. Thomas. There is no inconvenience. He's so quiet. The voice is so calm. There is no inconvenience if something being supposed, a man is not able to avoid wrongful action. Just as, supposing the intention of vainglory, he who is obligated to give alms is not able to avoid acting wrongly. For if he gives from such an intention, he acts wrongly. But if he does not give, he violates his obligation. We could put in the malicious prosecutor into that sentence. So St. Thomas, he said, on the supposition of this intent, the intent of malice, the prosecutor cannot act well. Now, St. Thomas says he can give up his intention. Sidgwick quarrels with him on that point. We don't need to adjudicate that dispute in order to argue on behalf of St. Thomas's account. Let me read a little short sentence from St. Thomas where he says, just as in syllogisms, in logic, given one error, it is necessary that others follow. It's necessary, Sidgwick, given this error of malice on the part of the prosecutor. Of course he can't prosecute well. That follows with necessity. So, he says, given one error, it is necessary that others follow. So also in morals. One error posited, from necessity, others follow. So, Sidgwick wants us to just think about this individual here and now. Here and now, he's incapable of prosecuting without malice. But what St. Thomas is drawing our attention to is, well, how did that come about? How did he get into that situation? Now, St. Thomas thinks, in his discussion of, he has 18 discussions of moral dilemmas, what I call moral dilemmas, and a number of them are devoted to, on the supposition of an intent, like this one about vainglory and giving alms. And St. Thomas says, well, you just give up the intent. Sidgwick quarrels and says, well, he's not able to. But we don't need to address that dispute between Sidgwick and Aquinas in order to show that Aquinas prevails. Because St. Thomas tells us, well, okay, here and now, on the supposition of that intent, he cannot act well, no matter what he does. But this intent here and now has a history. It has a history. There was a time when he was able to avoid the formation of that intent. And therefore, we're not violating this principle that ought implies can, or that ought not implies able not to, because in the history of this agent, there was a time when he was able to avoid this malicious intent. So, St. Thomas prevails in this dispute. And I wanted to conclude, there's our fellow, he's gotten himself into a difficulty, right? But there was a time, St. Thomas is saying, where he could have avoided that problem. Right? But I want to end with another Thomas of Becket. And you, of course, in your sophomore year, are reading the Canterbury Tales. And the pilgrims are on their way to the Cathedral of Canterbury, where a shrine to St. Thomas of Becket was erected upon his martyrdom in 1170. This is a mosaic which was erected. He was canonized in 1173. This mosaic was made within 13 years of his death in Palermo, Italy, in the city of Monreale, right outside of Palermo, Italy. And this St. Thomas was brought to my attention by Anscombe, because Anscombe, in her little discussion of Sidgwick, she talks about temptation, that you get rid of the intent of foreseen distinction, and then she says, by it, the kind of consideration which formerly would have been regarded as a temptation, it was given a status by moral philosophers. And there's a passage in a play by the poet T.S. Eliot, whom you read in the curriculum, where he, in the play Murder in the Cathedral, where he depicts the martyrdom of Thomas of Becket. And he has Thomas encountering 4 tempters. The first 3 tempters tempt Thomas to avoid martyrdom. Avoid martyrdom for the sake of pleasure, avoid martyrdom for the sake of power, avoid martyrdom for the sake of rebellion. The 4th tempter, however, whom Thomas says, oh, I did not expect you. You're an unexpected temptation. The 4th tempter tempts him to undergo martyrdom. But he tempts him to undergo martyrdom for self-aggrandizement, not for the greater glory of God, but for his own glorification. And here's what Eliot has Thomas Becket say? Now is my way clear. Now is the meaning plain. Temptation shall not come in this kind again. The last temptation is the greatest treason. To do the right deed for the wrong reason. I think that today we began in Mass, and Father Kelly, we had read from the text of wisdom in the fresco earlier. Thomas held a text, and that text is Wisdom 7, chapter 7, verse 7, which we read today in the liturgy. And it says, I willed, and understanding was given to me. I prayed, and the spirit of wisdom came upon me. And I preferred her before kingdoms and thrones. I hope that we see the truth of that claim. Thank you.